Robotic hair transplantation, robot assisted hair transplantation. What is this? Is it available in India? Is it better than a human being? Should somebody go for it? These questions I will answer in the course of this lecture. I am Dr. Venkat Mysore, dermatologist, hair transplant surgeon from Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banshankari, Cunningham. Yes, there is something called robotic hair transplantation. There is a machine called ARTAS, which does the job of robotic, which means there is computer assisted technology. What can it do? One, it can assess the number of grafts needed. It can assist in the distribution of grafts. And in the donor area, it can extract by FUE technique, Follicular Unit Extraction technique. It has a set of mirrors which, assisted by artificial intelligence, it can assess and pick up the best graft suitable, 2 grafts, 3 grafts, 4 hair grafts, like that. Pick them up. And the latest robotic can also do the slit making. It can make holes for these grafts to be placed. That is what it can do right now. It still cannot place the grafts in these holes. So that one crucial step is still manual, even if you use the latest machine. So this is robotic hair transplantation. So now sometimes we have people asking, Doctor, do you have robotic hair transplant? I want to do robotic hair transplant. Do we have? No, we don't have. In India, as far as we know, only one machine had come to Mumbai just before the lockdown. Most other so-called robotic machines are not true robots. They do some mechanized job, but they are not true robots. True robot in the world is only one, that is ARTAS. Why it is not available? Simply because of its cost. It is very expensive. If supposing somebody buys a robotic machine, the minimum cost would be between $7 to $8 per graft, which is about 600 rupees per graft. Now we are not even charging 1 rupee per graft. I'm sorry, $1 per graft. We will have to charge $8 per graft, which is prohibitively expensive. Because of this, most hair transplant surgeons are not using robot. But then people say, Doctor, I have seen an ad. It is available in this city. It is available in that city. As I explained to you, they are not true robots. They are mechanized. Some parts of the process are mechanized. There are different machines for it. Those machines are not robots. So unless you see the name ARTAS as of now, such machines are not robots. Does it mean that robot is better? That's an entirely different issue. Now, is robot really better? See, robot does what a human being does. A robot will not get tired. But otherwise, human beings can do everything in the robot. But human beings can use the brain and the art. Because each patient is different, some elements will vary from patient to patient. That is why a perception of a human brain is important. Now, extraction process, that is where robot really has found its application, is a mechanized repetitive procedure. So it is very suitable for a robot. But the same thing can be done by a doctor. Now, when the first robot was introduced a few years back, it used to pick up 300 to 400 grafts in an hour. Just like when FE started, human beings were doing 300 to 400 grafts. Now human beings can do 1500. There are people who do 2000 per hour. The robotic has still not reached that speed. Please understand this. Robot is good, it can reach up to 1000, but an experienced FUE surgeon, like for example, in our center we have Dr. Anike, he routinely does 1500 and in some cases can go up to 1800 per hour. So an expert hair transplant surgeon is still better than a robot. Please understand this. Then the next component, hairline design, placing of grafts, these still are beyond a robotic. It might come, machines keep improving with time, but as of now, it is a human being who still reigns supreme in the field of hair transplant surgeon, even if the doctor has a robotic. Please understand this. In most cases where there is a robot is helping the doctor to do transplantation. It is not doing it independently. Doctor still is there. Human brain still is superior. This is very important to understand. Then what about the other machines wherein some clinics are advertising and claiming that they have a robot? As I explained to you, FUE process was fully manual a decade back. Progressively, different machines have come to automate and mechanize different parts of the extraction. Such machines, even we are using it. But that is not a robotic. So, when you look at an advertisement which claims to do robot, please find out what it does. Is it our task? Is it something else? Do not fall for a gimmick. At the current cost, nobody can do a robotic hair transplant at 100 rupees or 150. It has to be at least 700 rupees or 800 rupees per gram because the economics simply doesn't work. And as I said earlier, as far as we know, only one machine was supposed to have come to Mumbai. It is not present elsewhere as far as our knowledge goes, and we know pretty well in this field. Most other machines are automated FUE machines, which we are also using. So do not fall to misleading advertisements. Now, if this is so, what do we do in our center? We have 2-3 different types of FUE machines wherein we can adjust different parameters. See, in FUE, there are 2-3 things which are important. One are the characteristics of hair, the color, the curliness, the thickness, the type of unit, 2 hair, 3 hair, 4 hair units. This is one part. The second part is the tensile strength or the firmness of the skin, how fast the machine should go, how fast it should rotate, what depth it should go. These all depend upon the properties of the skin. The third is the skill of the surgeon to visualize where to take, what should be the depth. He gets a feel. These are the 3 parameters. And in this, the experience counts, the skill counts. We have machines which can adjust the speed, the torque, the depth, these kind of physical parameters. Our Dr. Aniket is an expert on this. He has actually presented a research paper wherein these properties of torque, speed can be adjusted and best results can be obtained depending on the patient's skin. So we have a lot of experience in this. That is why our transaction rates are very less. It is less than 1% in most cases, which is much better than ARTAS, the robotic. Even with ARTAS, the transaction rate is supposed to be between 3 to 5%. And in our center, the transaction rate is just 1%. In very difficult cases, it may be 1.5 or 2%. So once the skill is there, once the knowledge of the properties of the skin are there, the machine is understood, human being is much better, at least as on today's technology. So in our center, we use automated machines. The machine is chosen depending on the patient. The parameters of the machine are depending on the patient. With that, we can get the best results. So This is about robotic hair transplant. Be careful, understand what a robotic does, check and confirm whether the machine in the clinic is really robotic or something else. And remember, man is always very important. Man and machine together give the best result, not just the machine. It is man and machine. It is not man versus machine, it is man with machine. I hope you have liked this video. If you have, please like it and share it to others. If you have any more suggestions, please send it to us. Visit our website, venkatcenter.com. Thank you.